and the relationship between our hearing systems and our cognitive health. Because there's a really landmark study that came out in 2023 called the Achieve study. It was a large National Institutes of Health funded randomized control trial. And it found that for older adults who were at some risk of dementia, that could be cardiovascular risk, other kinds of health risk, could be family history. For adults in that group who had a risk of cognitive issues or dementia, and for those that had hearing loss, which hearing loss affects a lot of older adults, for those who had hearing loss, they separated a group who got hearing treatment for their hearing loss versus a group who did not. And they found that the group that got hearing treatment, they reduced the rate of cognitive decline by 48% over 3 years. So that showed us, wow, hearing is sort of this hidden key variable in keeping our brains healthy. And Richard, I've liked to use the phrase of, we want our brains to live as long as our bodies. So that's why that's probably the most compelling reason for individuals to hear our discussion today about hearing.
Hello, Dr. Thompson. You are a doctor of audiology and the founder of Treble Health, which is a private practice offering tinnitus treatment. So welcome to Modern Healthspan, and thank you so much for joining us today.
So excited to be here to talk about the ear and the brain.
Yes, yeah, and the way that they connect, that is so important. So I think we kind of have this idea, like everything, everything decreases with age, and that includes our hearing. So we have this kind of feeling that hearing gets worse with age. But can you put some more color into that? So how does hearing change with age, and like how prevalent is that?
Absolutely. Well, it's first worth mentioning that the ear and the brain work together. So the function of our hearing is to keep us alert to our environment, is so that we can hear and communicate. And in order to do that, the sound waves need to go through the ear canal, through the eardrum, into the tiniest bones of the human body, the 3 middle ear bones, and then into the cochlea, the hearing organ. And that has some sensitive little cells that vibrate when sound moves through the fluid in the inner ear. That then triggers an electrical signal that goes through the auditory nerve into the auditory brain. In the auditory cortex in the brain, that's where we can decode music and speech, and we can do fun things like go out to a restaurant where there's background noise, but still be able to hear people across the table from us. So where things go wrong most commonly is not the eardrum, and it's not the auditory brain. It's actually the cochlea, the hearing organ. That's our sensory organ, and it connects through the 8th cranial nerve. The cause of most people's hearing problems is the cochlea, or that organ in the sensory and neural division of the inner ear.
Okay. And so how does that change with age? Because we have these little hairs, right, that move, translating the sound into the electricity for the brain. What happens to them as we get older?
What happens is that we tend to lose our hearing of the high-pitched sounds or the high-frequency signal. And this can manifest very subtly, noticing it's a little harder to hear in a crowded place like a restaurant or a group dinner party. Noticing I'm spending more mental energy trying to decode what someone's saying. Or people are not speaking as clearly as they once used to. Very subtle changes, or maybe needing the volume up on the television to hear the voices more clearly. So those are some symptoms of hearing loss, right? Then there's also a common symptom of hearing loss, which is ringing or hissing in the ears or in the head. And that's called tinnitus. I'll pronounce it tinnitus for the rest of this talk, as that's more common in my line of work. So that ringing sound, or the hissing sound, that is essentially a phantom sound response where the auditory brain is not receiving the input from soft, high-pitched sounds because of the hearing loss in the cochlea. So then the auditory brain makes up this phantom sound that people say, hey, I hear this sound in my head. I hear it when I'm trying to fall asleep, when I'm trying to relax and quiet. It's a ringing sound. What is it? Where does it come from? So that's how all these symptoms and conditions work together. I want to talk, Richard, in this discussion about the importance of people who are 40, 50 years old or more, or they have family who are older adults, and the relationship between our hearing systems and our cognitive health. Because there's a really landmark study that came out in 2023 called the Achieve study. It was a large National Institutes of Health funded randomized control trial, and it found that for older adults who were at some risk of dementia, that could be cardiovascular risk, other kinds of health risk, could be family history. For adults in that group who had a risk of cognitive issues or dementia, and for those that had hearing loss, which hearing loss affects a lot of older adults, for those who had hearing loss, they separated a group who got hearing treatment for their hearing loss versus a group who did not. And they found that the group that got hearing treatment, they reduced the rate of cognitive decline by 48% over 3 years. So that showed us, wow, hearing is sort of this hidden key variable in keeping our brains healthy. And Richard, I've liked to use the phrase of we want our brains to live as long as our bodies. So that's why that's probably the most compelling reason for individuals to hear our discussion today about hearing.
So going into a little bit of detail there. So you said it was because these participants already had dementia, and then it was like how fast it progressed. But that was because that's who was chosen for the study. I mean, there's no reason to think that for people who don't have dementia, like if you don't have, if your hearing decreases, then that would also impact your cognitive ability.
Research is pointing more and more to that for individuals who have a risk of dementia or who have some early signs of it, that treating hearing loss is really, really important. What you're saying, I think, is the future of where the research is going, which is to say, well, what about people who just have a hearing loss and otherwise are doing pretty well? How important for their brains is it? There's interesting imaging studies that found even a mild hearing loss. They found through imaging studies that the visual cortex of the brain was taking over the unused auditory portions of the brain that were not stimulated because they weren't getting any input because of a hearing loss. So time will tell on how this all plays out, but certainly it has been well known here in the past few years and promoted that, hey, if you have a hearing loss, you should consider taking care of it in order to protect your cognitive health. And I'm definitely going to be following it. It's really exciting.
When do people start losing their hearing? When does it start impacting their life?
Great question. In my experience, hearing loss starts to impact people's lives in their 60s or 70s. Tinnitus, for those who have it, tinnitus, that can start to impact people's lives commonly in their 50s or 60s.
Is it like 100%? Like, everybody suffers hearing loss. It's just a natural thing.
It's not. I've certainly had I've done hearing tests, performed hearing exams on patients who are 85 years old, and their hearing test comes out great. And some researchers have explained to me that it might not be what we thought, where we may have thought in the past, oh, there's age-related hearing loss. Everyone loses their hearing significantly. Some researchers are believing now it might actually be the amount of noise we're exposed to over the course of our lifetime. How it's actually the noise exposure that could be leading to the hearing loss in addition to the aging process. So there are things we can do for our hearing brain, hearing treatment, and there are things we can do to prevent hearing loss, which are just being aware of loud noise exposure and how to protect our ears.
So you talked a little bit about the structure of the ear. So I believe there's two types of things that can go wrong, right? There's sensorineural and conductive hearing loss. Can you explain what the difference is between those two?
Yes. Noise related hearing loss, loud noise causes hearing loss, or age related hearing loss. Those are called sensory neural. It's that hearing organ, the cochlea, those little hair cells which vibrate and become the electrical signal. Similar to how if I walk on my lawn, then the blades of grass will be bent and eventually the blades of grass will be compressed. Um, that is referring to the sensory neural hearing loss, which is the most common type. Conductive hearing loss, this is referring to ear infections, eardrum issues, um, certain surgical procedures that are needed for more medical cases.
And the hairs in the cochlea, in the cochlea, they don't regenerate. Is that right?
That's correct. Researchers have been trying to regenerate them. They've had some success with bird hair cells of the inner ear, but with humans, we have not had success of regenerating or regrowing those sensory cells as of yet.
Okay. Yeah, no, I was just thinking about because there's some ways of regenerating, making the body younger using reprogramming of using the Yamanaka factors and doing partial reprogramming, whether that would help. So does I mean, suppose they get damaged when you're really young. Do we know whether really young people will also not regenerate?
That's correct. Uh, as of today, even pediatric patients or children who have hearing loss, they will not regenerate. However, there are certain kinds of hearing loss that are related to more systemic health issues, and there is ongoing research showing that hey, these children, within the first year of life, can regain some of that function. This has been studied for decades, so I can't predict the rate of improvement here. But there's a famous biohacker called Brian Johnson, and he actually has a hearing loss in one ear from shooting guns as a teenager. So loud noise exposure in one ear. He has a significant hearing loss in that ear, and I believe he measured all of his biomarkers, and the hearing loss is his worst biomarker. So his ear is 75 years old, and he hasn't figured out how to reduce it. Well, neither have we in our profession.
Okay. How do we measure hearing? I mean, what are the units? What kind of value would you look for?
We measure hearing with what's called an audiogram. So it measures the sensitivity of our hearing for different pitch frequencies, and it measures between 250 and 8,000 hertz. So that essentially is the humming of certain motors up to the tweets of bird songs. And we can measure someone's hearing, and it gives us a graph or a line of, hey, do you have any hearing loss? And if so, which pitches. Most commonly, people have hearing loss in the high frequencies or the high pitched tones. Also, most commonly, patients have tinnitus, the ringing in the ears, and it sounds high pitch. I started a YouTube channel and eventually a private practice called Treble Health. So when we think of pitch, we think of bass, mids, and treble. And most of these issues are in that treble region or the high frequency area.
So you don't get a single number. You get this graph that shows your response over the different wavelengths.
That's correct.
Okay. Can this be done at home? Are there any kind of home tools for this or any applications, or you have to go in and see an audiologist?
There are some screenings that can happen from home. Apple Health has a screening you can do with AirPods. So if anyone in your family has AirPods, you can use those, connect them to the iPhone, and do a free hearing screening that will give you, a general estimate of where your ears are at. And then for a more formal hearing test in a clinical setting, that would be the most appropriate way to do it.
When a new client comes in to visit you, And I assume you do this audiogram and you have a look. Is there anything else that you would look as part of the initial assessment to figure out how their hearing is?
Yes, definitely, definitely. So there are ways to measure the fine detailed structures of the eardrum and the cochlea, those small cells that we talked about earlier. Those would be part of an exam to understand where in the hearing system did things go wrong. Depending on how the patient is doing, we can also measure how the brain responds to certain sounds or how the person hears in a background noise setting. So picking out speech from background noise that measures the auditory brain's ability to separate signal from noise, which is a higher, more sophisticated function. We can measure all of that in a hearing test.
So beyond normal aging, so as we get older, these cells, these hair cells don't work so well. What are the biggest threats to hearing?
The biggest threat to hearing would be loud noise exposure. Uh, Second threat could be certain medications. A high dose of medications could impact hearing, but most commonly it's loud noise exposure. So that applies to people who maybe they have some power tools at home. Maybe they, have a wood saw. Maybe they are around loud music. They're a guitar hobbyist. They go to concerts. They go to the gunfire range. Anything like that can pose serious risk to cause hearing loss or cause tinnitus. And you can protect your hearing with either earplugs, small pieces that go in your ear canals, or with ear muffs, pieces that go over your ears.
You mentioned medications that may cause issues. Can you be more specific? Any types of medications to be careful of?
Generally, not something to worry about. Certain over-the-counter medications at a high dose can cause hearing loss, but that's usually temporary. Serious medical conditions like chemotherapy might have some components that can cause hearing loss. But the over-the-counter medications, aspirin, ibuprofen, certain NSAIDs, and SAID, at a high enough dosage, those could potentially cause hearing loss. So just be mindful of them, and yeah, just try not to over consume certain pain relievers at home without the advice of a doctor, and you should be fine.
Does diet play a role? Is there any diet that helps?
It might help on the margins, but there's not a certain diet that's recommended for hearing loss or improved hearing. For tinnitus is an issue that affects our brain in a very real way. So tinnitus can cause anxiety, it can cause insomnia, it can cause stress. All of those problems, anxiety, stress, and insomnia, especially if they're chronic issues, right? Someone's dealing with them for months or years. Those have a lot of downstream negative health effects on our bodies and our brains. So the tinnitus is a little more medically complex, where suddenly this one symptom or the sound can create this combination of really challenging health problems. So for that person, taking care of their nervous system is really important. Sleep, exercise, a holistic angle to it does help. And that's where some diet and nutrition could come into place. But generally with hearing conditions, we don't see diet or nutrition, moving the needle too much.
Does tinnitus, is it recoverable? I mean, can you recover from tinnitus?
You can. And that's probably the biggest message that needs to be shared on this subject, is that you can recover from tinnitus. There is hope. There's something you can do about it. Unfortunately, most people go to an ear, nose, and throat physician clinic, or they see a certain specialist, and they're told, hey, you have tinnitus. Sorry, there's not much you can do. You just have to learn to live with it. While there's no cure, meaning remove it 100%, that's very rare to remove 100% for patients. It is quite common in our practice when we work with patients, and my team of doctors and I, where we can reduce the signal by 50% at the end of a treatment period, where we can improve the tinnitus. We can have someone recover to their normal life. So that is a message that I'm happy to share to people is that if you've been told by others there's not much you can do and you're really suffering with this, it's a moderate to severe level of tinnitus, that there are treatment protocols to follow. We can speak about them. But that's where I have the most experience as an audiologist, is specializing in the tinnitus and working with hundreds of patients personally.
Well, now would actually be a good time to talk about the protocols that you have. I mean, how do they work?
How they work is by understanding first, what is the root cause of this patient's tinnitus? It's not only hearing loss. There's other factors that commonly affect tinnitus. So one of them could be the central nervous system. If someone went through a significant period of stress in their life, if their nervous system is on high alert, then they could have what's called stress-induced tinnitus. Additionally, if someone has issues related to the jaw or the neck, TMJ problems, tightness in their trigeminal nerve, another cranial nerve that goes next to the hearing nerve, that could actually lead to the onset or the exacerbation of tinnitus. So understanding that individual's history really well and doing some test results, that allows us to be specific on, here's the treatment protocol based on what's causing this for you. At that point, the treatments are typically a combination of two main pillars. One is a sound-based component, and the second is a cognitive-based component. So for someone who I work with, let's say the average patient, they have some high-pitched hearing loss, but they're really struggling with tinnitus. That's their main problem. In that particular case, I would recommend hearing devices on the ears that play what's called sound therapy, and they correct for the hearing loss to some degree. And then also having one-on-one coaching sessions, which are teaching the person specific strategies and protocols for sleep, stress management, anxiety reduction, getting the nervous system in a good place, also stimulating the auditory parts of the brain. When both of those can happen, the brain can do something called habituation, where the brain can reduce the intensity and perception of the sound. A good example of this is, think about the sound of our breathing. I'm breathing in and out of my nose right now. Well, I can hear it, it's there. But how often do I think about my breath and the sound of it? I never do. So the brain has an amazing ability to filter out neutral sounds. And we're using some of that ability of the brain to reduce the baseline level of tinnitus for an individual. So that, let's say after an 8-month treatment window, the patient says, hey, I started at a 7 out of 10. This was a serious problem. Now I'm at a 3 out of 10. I feel like myself again. This isn't really bothering me anymore. Those are the kind of results that we see. And that's a message I'm proud to share for people who aren't aware that there is something they can do for chronic ringing in the ears.
Thank you. So for loud noises, let's going back to loud noises. I mean, how loud is loud? Is it, I mean, I assume it's like a slope, right? I mean, where you start to how it's not like there's some cutoff, but yeah, how loud is too loud? Can you measure it and say, well, if it's more than this?
Yes, there's a way to measure sound through an iPhone or through an Android phone. You can get a free sound level meter. It's offered by the government, actually. So there's a free sound level meter you can download. It gives you the sound level via decibels. And anything over 85 decibels could potentially impact your hearing. So if you are curious of, hey, how loud is this concert I'm at? Oh, it's 98 decibels. Maybe I should wear my earplugs that I brought because Dr. Ben told me that I should wear them, and I'm such a good patient. That's what I would recommend, is if you're trying to be proactive in this, have that app on your phone, have some earplugs in your purse or on your keychain, and you'll be in a good spot. Loud sounds that people might not realize could be potentially dangerous would be, let's say you mow your lawn very frequently and you have a loud old lawnmower. That could be one. Let's say you use some power tools. Oh, I just use it every now and then. I don't need the earmuffs. Well, actually, if you're using a saw, I think you do. Things like that, playing loud music, being right next to the speaker at a concert. Those are things that once every happening just here and there probably won't do that much, but you should be careful, and it's a slippery slope.
Does the type of earphone you use when you're listening to music, does it matter? Like the outside ones or the ones that go in ear, is there any difference?
In terms of the health or protecting the health of your hearing system, I don't know of a difference between in the ear versus ear over the ear. The how loud you listen to it certainly can affect your hearing system. Where if it's near 100% and you're listening to that for hours, that is quite loud.
Right. So it is a matter of volume and time, like
Correct.
together,
Exactly.
that really matters. Yeah. So is there a problem with cardiovascular health, or in fact other systemic things, but cardiovascular health particularly with respect to hearing? I mean, if you have uh, impacted cardiovascular health, you have like high blood pressure. Does that impact your hearing?
Cardiovascular diseases can cause hearing loss or affect hearing by restricting blood flow and oxygen to the inner ear, the cochlea. It's not so common, but there is a link. So, if someone is trying to optimize their health, cardiovascular health is really key. And yes, that would have downstream effects on the hearing system.
Is there any other systemic things to worry about? Tell me.
There is some relationship between the kidney and the ears. So if someone has kidney problems or a kidney disease, that might be it might be worth getting a hearing test just to keep your ears healthy as well. And the reason for that is because as we as the embryo of a human, evolves in the early gestational ages, that the kidney and the ear are actually they share a similar biological makeup. So something's wrong with the kidney. Sometimes something can be wrong with the ears. Eastern medicine also connects the two as well.
Are there any supplements we can take for our ears? Is there any deficiencies that may have a negative impact on the ear?
The evidence there is not strong. I think there's some evidence that certain supplements may help, but very slightly on the margins, and I certainly don't promote any. Unfortunately, the world of supplements is um, is one that's not regulated by the FDA. So there are companies that advertise supplements for tinnitus, supplements for hearing loss. There's no legal body that can tell them they're doing anything wrong, even though, in my opinion, it's immoral and there's no science behind it. So I would dissuade people from supplements.
Cool. So I've got some problem with my hearing. I want some treatment. So what can I do about it? So how has the technology changed in recent years, and what should I use?
Yeah, great question. So if someone's noticing, I'm not hearing as well as I used to, I'm having to ask others to repeat themselves, going in a restaurant or a group setting, it's harder to hear. I think it's time I should try to check this out. The next step would be contacting an audiologist like myself and getting a hearing test. So at our tribal health clinic, what we would do is we would assess the person's hearing, make sure they have the right kind of hearing loss that hearing devices could help. And then we would say, hey, here's what you're coming in with. Here are the results we can get for you. And then we would recommend technology. So today's technology for hearing loss treatment, it's advanced. It's integrated with smartphones. It's a lot better than what you may have been used to with, thinking of your parents' hearing aids or some big bulky devices. Not at all. Very sleek, hardly visible, sometimes invisible devices that go in or up and around the ear. And there's even some smart glasses these days that have hearing aid features inside of glasses. So there's just a lot of technology options. Um, but the real benefit or what these devices should do is make it easier to hear people's voices in places that are hard to hear. So a place where there's background noise and you want to hear the person across the table from you, that's the result that today's technology can get. And it's better than ever in terms of the background noise suppression and the speech clarity. Um, I would recommend people consider speaking to an audiologist if they have any questions about this or are looking for some help on it, Richard.
Interesting. So the device is actually processing the sound and is boosting the voice against the background. So it's making that determination inside the device.
That's correct. There's a lot of automatic features that make the determination of what is the speech sound I'm trying to listen to versus what is background noise. There's also manual controls of, discreetly through a smartphone app, I can make some adjustments and hear people more clearly as well.
And it does this inside the device, right? So the device has that capability itself.
That's correct. Yeah, very advanced computer chips and rechargeable batteries and small devices, hearing devices, hearing aids have come a long way.
So are there any alternatives to traditional hearing aids?
Alternatives to traditional hearing aids. Well, there are certain devices that are they rest inside of the ear canal, so there's no visible piece at all. That's something that is intriguing to certain patients. Um, there's also over-the-counter hearing aids, so there's ways to get started with hearing treatment that might be more affordable or more entry level, but easier to get started with. Um, and then depending on the problem someone has, there are hearing aids specifically for tinnitus. There are hearing aids for severe hearing loss. There's all kinds of specializations amongst the technology.
Do you have any advice on how to start looking for an audiologist or a hearing specialist?
Yeah, great question. I would look two options. If someone wants to discuss their case with someone, there's telehealth. So we do a lot of telehealth consultations. That can be a quick, easy way to speak with a doctor and get some recommendations on their specific case, their history, what's recommended. If someone wants a hearing test or to get that in-person evaluation, then I would look for a doctor of audiology who's been practicing for at least a few years, who has reputable reviews on their website or Google Maps page. And I would call their clinic and talk to someone. And if things are feeling positive, then you can go in, and the first consultation is more of a discovery process of, okay, what's my hearing? What what is this doctor what is this doctor like? And then from there, if there's a treatment recommended, then you could do a risk-free trial in most cases and hear for yourself how much better you hear.
I mean, would it be worth people on a kind of scheduled basis checking their hearing? Like once a year, you go and get a hearing check.
Yeah, my recommendation is when someone turns 50, you should get a hearing test as a baseline. And then if there's any hearing loss, then we should test it either every 1 or every 2 years. If someone's 60 or above, then I would recommend testing it every year.
And that would be like, how long does that take? Or that would require you going into a clinic and doing a test.
That's correct. Yes. For a proper diagnostic test, yes. For a screening, we could do that remotely.
Oh, how would you do it remotely? Just
Yep.
out of interest.
Yeah, we would use different headphones. So any headphones at home could screen the hearing. We mentioned earlier AirPods, so that would probably be the easiest choice for people who have AirPods, but otherwise there's headphones that the patient could wear through their smartphone or through an iPad, and they could measure their hearing and monitor it as a screening to make sure there's no changes.
Okay. Is there an app that we could use just to do that at home so we can make some assessment as to our ability to hear different wavelengths?
There definitely are. There definitely are. Inside of the Apple devices, for example, There's the Apple Health feature that allows you to take that hearing test now. And through Android, there should be some options in the Android store for apps as well.
So, what are some of the biggest mistakes people make when dealing with hearing loss?
The biggest mistake people make with hearing loss is thinking that just a hearing aid will solve their problem and that all hearing aids are the same effectiveness. It's often the device plus changing different behaviors. So if you know that you really struggle to hear your partner, your spouse at home from a different room, or you can't hear that well at a restaurant in a group setting, well, having the technology will help you hear, but also really advocating for yourself, positioning yourself in the right place, bringing your friends and family on board with different communication strategies. That is what's going to get the best result. And in terms of the hearing aid, so you can buy a hearing aid for $200 on Amazon. You can buy a hearing aid for some thousands of dollars, and the technology is quite different. So in some sense, you get what you pay for, and I think that is I think working with a trusted specialist is helpful in the sense of, okay, if you get what you pay for and you're looking for hearing aid treatment, then make sure you're getting something that is of the appropriate value that you're paying for.
So, would you expect a hearing aid to last a long time? I mean, if as you get older, maybe your hearing further deteriorates. Would the same hearing aid work and be flexible enough to handle that? Or is it like glasses? You need to get new ones depending upon how your ears or eyes are.
The average patient would get new hearing aids about every 5 years, and the hardware or the physical device would remain the same, but the software or how it's programmed, the settings would evolve and adapt. So if we retest your hearing in 2 years and actually you have more hearing loss, the same hearing aids would be appropriate for you in a vast majority of cases.
Right. So it's interesting, the things you mentioned, like the behavior changes, were not actually about hearing. They were more about, like, I guess the behavioral and the mental impact of being able to hear or not hear.
Mhm. Yeah, I would frame it like their communication strategies, right? So right now, if my girlfriend at home, she says, Ben, do you want to have dinner later? But she's talking to me from the other side of the house. I have pretty good hearing, but still I can barely hear her. So even right now, I could benefit from saying, Hey, honey, I can't hear you when you're so far away. So maybe just start by saying my name, Ben, and if I don't respond, come closer to me until I do respond, and then I can hear what you're saying. So you can get a sense of how these kinds of communication strategies might even help more than a hearing aid in some situations.
Right. Well, it certainly reduce the stress. Yeah.
And
Um,
actually, you can hear better. Like I can't hear her when she's across the house. When she's in the room with me, I can hear her.
right. So, what is one myth about hearing loss that you think we should talk about?
I think a myth about hearing loss is that uh, the that hearing aids are bulky and use these annoying batteries and that they don't work. Quite the opposite these days. For people who do it right, they're sleek, they're modern, rechargeable, and they work really well.
Yes. And just because of the mental health, it's worth keeping them, using them. Where do you see the future of hearing? What are the big things that kind of need to be addressed? I mean, certainly like regrowing the hairs in the cochlea would be good.
Yeah, what I see interesting is that right now in the world, there's AI data. There's also these sophisticated Bluetooth devices. There's a lot of people wearing technology with microphones on them for a lot of the day. So I see this world where our devices that we have on us, whether it's our smartphone or our watch, or potentially in the future, not too distant future, smart glasses or smart hearing aids, all these systems will talk to each other, and they'll be our personal assistant. They'll be helping us make decisions. They'll be analyzing the world and giving us data and giving us options, more information. Uh, that's where they'll be analyzing, for example, right now, there's hearing aids that can detect if someone has fallen on the ground. So there's value there, because if there's a 75-year-old woman who lives alone, similar to the old life alert, lanyards, the hearing aid itself can function today like a life alert system, where it can send a message or notify a family member. So, that's just an early sign of the sophistication of what all these wearable technologies can do.
Yes. Is there anything in that we should have covered that I have not asked you about?
I think the one thing to cover that we haven't discussed, Richard, would be that for patients with tinnitus, or if anyone knows someone with tinnitus, is that it really is a serious problem because it's invisible, because not that many people think there's anything you can do. A lot of people suffer with it. And I want to say they're valid. It's real. It's a serious problem. That I'm one of the few doctors that specialize in it. For those patients who get help, they tell me, hey, I got my life back. And wow, I can live a normal and productive life, a fulfilling life, despite having some tinnitus still. That's my main message. That's my labor of love in my work, is to help people that are really suffering with this condition and do everything I can to make their lives better.
Excellent. Thank you. So, where can people go if they want more information or they want to get in contact with you?
If anyone wants to speak with a doctor on my team regarding tinnitus or hearing loss recommendations, then you can go to our website, treblehealth.com, or you can find us online. You can give us a call and have a consultation. We'd be happy to help you via telehealth, or we have in-person brick and mortar locations in San Francisco, Miami, Charlotte, North Carolina, and a few more coming later in 2025. So you can find us online, treblehealth.com, or you can call or visit one of our clinics across the country.
Are there any kind of government websites or other places where people can learn about kind of aging hearing in general?
It's a great question. I don't have any particular places that come to mind, but I do encourage people to investigate the relationship between cognitive decline and hearing health or hearing loss. Uh, it's amazing because the scientific community looked at what are the preventative measures someone can take, you know, in their older years to slow down cognitive decline. In addition to cardiovascular health and diet and exercise and social isolation, it was really surprising that one of the things that's actually in our control is that if someone has hearing loss, they should wear hearing aids. It's one of the top modifiable risk factors for dementia and cognitive decline. So that's something that is quite interesting in the realm of health span, longevity. I think that this is going to become an emerging factor, something that especially older adults are more aware of, and they'll probably be motivated to try to get help for it, because it really does matter. I want everyone's brains to live as long as their bodies.
Excellent. Okay, Dr. Thompson, thank you so much for joining us today.
You're welcome. It was a pleasure. Thanks so much.
Thank you.